Hey there, I'm starting a month-long digital fast, which means intentionally I'm limiting my screen time. But since my career requires using digital devices almost 95% of the time, I can't fully log off for the month. But I've already discovered something pretty eye-opening. In the last 10 days, I've realized that there's just not enough time to do all the things. And the wild part is I'm constantly multitasking, switching between projects before finishing the last one. Can you relate? Hi, I'm Tamisha Campbell, and I help healthcare providers like you challenge bias, reduce healthcare disparities, and deliver patient-centered care that serves Black women. And in today's video, we're going to dive into a huge issue: burnout and bias in healthcare. Specifically, I'm going to share a story to illustrate how these issues impact your patients, especially Black women, and give you some actionable steps to help make your care more inclusive. So let's face it, healthcare providers are constantly pressured to do more in less time, and here's the kicker. That pressure sets us up for burnout and bias. Let me explain. When you're constantly burning the candle at both ends, it impacts how you show up at work, and not just for you, it affects your patients too. Take my colleague Kendra, for example. She was just starting off as a PA and she was eager to prove herself, so she'd arrive early, stay late, and go the extra mile. But as you might guess, the stress and exhaustion started catching up with her, and eventually it affected her work performance. And her managers had to sit her down and explain she was making a lot of mistakes. So she realized the long hours combined with the hour-long commute were draining, and all the stress was impacting the way she showed up for her patients. Now, burnout isn't the only challenge healthcare providers face. There's also bias, something we all have, whether we want to admit it or not. And when healthcare providers don't confront their bias, it doesn't just disappear. It can show up in clinical decisions, like with Jaleesa. Jaleesa is a 54-year-old woman with abdominal pain and weight gain, and she was immediately diagnosed with monstrous obesity. But after a CT scan, doctors found a 46-kilo mass. The real issue was a whole tumor, and weight bias likely caused other healthcare providers to miss it. This is a clear case of how weight bias can lead to misdiagnosis, and unfortunately, this isn't an isolated incident. Weight bias is rampant in the healthcare system, and it disproportionately harms Black women, especially those with higher weight. The truth is, health disparities in the Black community aren't just about individual choices. They're about deep-rooted inequities in the healthcare system. And that's why it's vital for healthcare providers to care for their patients and actively work to change the system. So how do we start making a change? Here are 3 ways you can begin to tackle weight bias and burnout in your practice. 1. Invest the time to learn about weight-inclusive approaches. Whether you work in a private practice or a healthcare system, consider blocking off time for training on weight-inclusive care. Learning how to provide equitable care to all patients, regardless of their weight, is essential. 2. Recognize when you're burning the candle at both ends. Burnout makes it impossible to deliver the best care. If you're feeling emotionally drained, having trouble sleeping, or your productivity is sleeping, it's time to take a step back. Burnout isn't just bad for you, it's bad for your patients too. So take care of yourself first. And 3, check your bias at the examination door. Bias is embedded in the healthcare system, but that doesn't mean it's okay. Start with questioning assumptions. For example, don't just assume someone with a lower weight is automatically healthy. You don't know what's happening in their lifestyle behind the scenes, so ask the right questions and base your decisions on facts, not assumptions. Now, I know this stuff isn't always easy to tackle, and I've made my fair share of mistakes as a health coach, and I'm absolutely not throwing shade at anyone who doesn't know what they don't know. But our training programs don't teach weight inclusivity, but that doesn't mean we can ignore it. I'm hosting a live class in a couple weeks to share some proven strategies for providing patient-centered care without relying on weight. So if you're interested, subscribe to my Substack to get all the details and be the first to know when registration opens. Thanks so much for watching. If you found this video helpful, don't forget to hit the like button and subscribe for more insights on health equity and delivering better care for Black women